You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know about gum disease. Millions and millions of Americans have it. They don't even know it. It's under the gum line. My first guest says, if caught early, easy to treat. No more bleeding gums, no more bad breath. With us, we have Dr. David Johnson. Dr. Johnson, welcome to the program.
Hi there, Randy. Thank you very much.
So a periodontist.
Yes, sir.
Is that right? Okay, so before we get into the topic, tell me about your practice, by the way.
Okay.
You're in Fort Collins, is that right?
I'm in Fort Collins, Colorado. Yes, sir.
What procedures do you do?
We do everything that pertains to the gums and the tissues that hold the teeth in.
Okay.
People don't think about them a lot. You see the teeth, but we also have gums, and that kind of frames your smile. So this is everything that deals with gums. So I'm talking about if you're an actress and you have some gums that are shrinking up and looking long, we can make those teeth look shorter. Or you may have too much gums, and we can get rid of those extra gums so your teeth look more natural. That beautiful Hollywood smile that everybody wants to have.
It's like a gummy smile. You take care of those.
Get rid of that gummy smile, you bet.
Okay,
and then we can also deal with some of the more severe things where people are actually having diseases of their gums, where their gums are bleeding, their breath is bad, their teeth are getting loose, or sometimes even drifting apart.
You see a lot of that?
We do. We see a lot. As a profession, we do, but you're not going to see it walking around because those people are afraid to smile, and so they're not showing their teeth. They're hiding them all the time. You'll see them smiling like this or putting their hands up, and you're just not getting a good look at what their smile really looks like. But sure, they're everywhere, and we can fix that. We treat kids, we treat adults, whatever problems can possibly happen.
So you get referred by the general dentist?
Usually, yes.
The periodontist. I mean, people don't like going to the dentist, right?
No, nobody likes to go to the dentist.
The specialist, right?
No, nobody wants to have to come to see me.
Do you hear that?
I hear it a lot.
What do they say?
Yeah. Oh, I'm so scared to be here. I've heard horrible things about periodontists. And yeah, it's a little bit scary sometimes, but really we're here to help you, and we can make your smile and you feel a whole lot better. And I'm not a scary guy once you get to know me a little bit, just at first.
Now, you have kind of a team there. You have two other people. Tell me about them.
Dr. Lindenberg is my partner. He's been practicing in Fort Collins for a long time. I'll let
like 30 years or something like that?
More than that. I'll let him fill in exactly how long. And he's a great guy. He's very experienced, knows what he's doing, has been treating gum disease since way back in the 70s. And then Dr. Merritt, she's pretty new to our practice. She's our associate, and she has joined us.
She's like the cosmetic gal, but that does gums, right?
She's so good. Her work is amazing. She's an artist. She does wonderful work with cosmetic dentistry.
Now, when you say that, by the way, in the world of periodontics, I mean, you can tell the difference between like really good work?
Yes, you absolutely can.
Really? Really?
Yes. Okay. Yes, you can. And if you want to really be happy, you want to go somebody who knows what they're doing.
Okay.
And she does.
Okay, good. Okay, so let's begin with, and first of all, your training as a periodontist, briefly, because I have a lot of questions here about gum disease.
Sure.
What's a periodontist after dental school, then what?
Right, well, so we go to regular dental school, and then we go to a residency program for 3 additional years, where we learn all about all the diseases that can happen to gums and how to fix them, where we learn about dental implants, where we learn about how to regrow bone and tissue, and where we learn how to do IV sedation. So it's a far more complex training, and we're learning about kind of a more general application of our trade.
So you do IV on just about everybody that goes in?
Anybody who wants it. If they're nervous in any way, shape, or form, we can make them more comfortable. So we don't push it on them, because I don't want to do that. But if somebody feels nervous, absolutely.
And it's safe. I mean, I've been talking to a few guys. They say it's safer than the pills or
it is because you're closely monitored.
Do they remember?
No, they don't remember.
So with IV, they don't remember, really.
It's kind of funny, and it's kind of like Las Vegas. What you say here stays here. You know, we're not going to go bragging about the crazy things that you might say. So it'll stay there.
All right, all right. Now, so gum disease, what defines it? I mean, what is it? I mean, now there's a lot of press about it, you know, with heart disease and diabetes and things like that. But what defines gum disease or periodontal disease, and are they the same thing?
Yeah, gum disease and periodontal disease is just periodontal disease is a fancy way of saying it. So it's exactly the same thing. And what you're looking at are any processes that causes an infection in your gums. And these can start from germs, from bacteria under the gum line. It can start from problems with your immune system. Basically, it's anything that makes your gums not right.
Okay.
And these manifest themselves. Like? Yeah, you can see them in all kinds of different ways. What most people notice first is they'll notice some bleeding when they brush. And then it'll be, especially if they're trying to floss. When they brush, yeah. Okay. You'll have a little red, or you'll taste that metallic coppery taste.
Right?
No, you should never, ever bleed at any time in your gums.
What does it mean, by the way, then, to you?
What that means is that you have an infection and their gums are inflamed. And as we know more and more, and even in the medical community, we're talking about the danger of inflammation systemically and just acutely. If you had this kind of an infection on your hand or on your face, you'd be running to the emergency room immediately because you'd want to know what the heck was going on.
So it's an infection under The gum line.
It's an infection that's wearing away your tissues. It's your gums, it's your bone, can even be the roots of your teeth, and they're all being attacked by this germ.
Okay, I don't want to overstate it, but is it easy to treat if you catch it early?
It absolutely is easy to treat if we can get on it early enough.
Okay.
Because once teeth start getting loose, that's when we start running into trouble, is when the teeth start getting loose. And even when they are loose, we can fix them.
So the breath, when somebody has chronic bad breath, how is the connection between this infection and the bad breath?
It all comes back to the bacteria. They're feeding on certain compounds in your mouth, and they generate all these smells.
So under the gum line?
Under the gum line.
It's like a rotting under there or something?
All over the place. It's kind of like a rotting. I wouldn't like to describe it like that. It's more like a barfing than a rotting. It's the bacteria are dumping all these chemicals in, and it's causing a chemical reaction. It's the same smell that skunks make, basically. It's all the same compounds.
Right?
Sure. Yeah,
really?
They're related to it.
That's the first I've ever heard that on this show.
Well,
the same compound.
There it is. Well, basic class of compounds.
Okay.
Yeah.
Now you brought a model.
I did bring a
disease.
model. Yeah.
Okay.
Okay, this is, I
You
like this
travel with
model.
this because you flew here, so you must
This is
travel.
my little buddy. I brought him in my
Okay,
bag. Yeah,
all right.
he rode all the way with me. So what I like is this doesn't look too bad. I don't know if you can see this. Can you see this over there?
I'll zoom in on it. Okay.
All right, good. So what I want everybody to see is that you can see that the teeth are here and the gums are here. Does that look too bad to you?
No, it looks
doesn't look too bad to me. But then you kind of look over on this side and this tooth looks a little funky. Then let's look a little closer what's happening underneath. So when I move the gums back, I won't do this to you, I promise. This isn't what your surgery is
Okay,
like.
so point that toward the camera a little bit. Okay, so is that typical, by the way? You will see a discolored, it's supposed to be white. It's supposed to be white.
Yes.
Okay.
Well, it can be a little darker because it's the root, not the tooth, but it will definitely be darkened in gum disease. And there'll be all these little black spots on there. That's tartar. That's what is the base cause of all this trouble.
So you go in and do what?
We get rid of the tartar. That's right. And sometimes we have to help your body adapt. And that's the main part of my job, is I know how to help your body adapt to having those bacteria there. If you have problems with bleeding, with gingivitis, which we haven't really talked about yet. I'm hoping we get to discuss a little bit more about the diseases later. But if you have problems, as long as we get in there in an early enough time, I can completely reverse this process.
Okay, when is it gum disease? When is it gingivitis?
Okay, that's a very good question, Randy. I like that question a lot, because there are
I'm asking the good questions today.
150 million Americans walking around with gingivitis. In fact, this is my dirty little secret. I've been one of them, okay? Everybody has a time in their life when they have gingivitis. It's normal, okay? Now, the problem is if that takes the next step. And the next step is it gets into your bones, okay? So when it's gingivitis, it's just in your gums, the soft tissue. If it gets into your bone and that bone starts to dissolve, which is what the bacteria do,
interesting.
Now it's hard to fix. And now I'm starting to have to do more significant things.
Is gingivitis like plaque?
Gingivitis starts from the presence of plaque and your body's response to it. And I don't want people to feel bad, like they're not, oh, I'm never brushing my teeth. Because you hear that. Dentists will yell at people, oh, you're not brushing your teeth, you never pick up floss. But that's not what it is. It's a complex interaction between your body and the germs that it has. So you can blame your mom and dad if you want to for giving you the immune system that you have and the germs that you have. Yes, you need to brush and floss. You didn't hear it here that I said don't brush and floss. But the basic problem is your germs and your immune system don't get along, and you're suffering for that.
So the number one reason why people lose their teeth is gum disease.
Absolutely.
Okay.
Yes.
So bleeding gums is where it begins.
That's where it
if you have
starts.
bleeding gums, you have a chronic infection.
You need to
come
come
if
see
you're
us.
flossing and it's bleeding,
right.
I want to get this right, okay, that you have an infection on your gum lines.
Correct.
That is eating, and these are my words, but
yeah.
that are eating away at the root a little bit?
Some on the root, but it's the bone. That's the one.
So it's eating the bone, and then when the bone goes away, the tooth falls out.
Tooth gets loose and falls out, and it's a natural process. It's supposed to happen. It's how your body protects itself from infections. It wants to get rid of the offending body part.
So what are the current treatment options? I mean, could this be? I mean, with IV sedation, things like that. I mean, pain does not have to be an issue if you catch it early.
Right. There won't be any pain if you catch it early. Okay. There might be a little bit afterwards, but it's not going to be anything like it was 10, 15 years ago. We've really refined our techniques. I don't want to promise that it's going to be 100%.
Yeah. But is pain something they complain about at the early stages?
No, it is not. So what I want people to do is get in and let us do a cleaning of their mouth and get rid of these bacteria. And if they can keep it that way, they may never have to have another thing done in their whole life.
Now, if this is an infection, okay?
It is.
And by the way, nobody wants to lose their teeth, okay?
No.
Is prevention, though, a tough sell? I mean, people, especially men, we like to wait until the last minute
to
go see.
Yeah.
So how do you get these people in?
Absolutely. Well, what we need people to understand is that there are a lot of other clues besides just bleeding that we're looking for. Because you know what? To be honest, some of us aren't brushing our teeth enough to even notice those kind of things. Okay. But our wives might tell us, "Oh, honey, your breath was horrible this morning." That's a clue. If my teeth are loose, that's a clue. If I'm feeling hot and cold sensitivity every time I brush or when I walk outside and take a good deep breath of that fresh Colorado air, if my teeth are hurting,
even when they breathe in, they will say?
Absolutely.
Interesting, okay.
Yeah, those exposed roots can do that to you.
Okay, so the hot and cold when they're drinking, cold things or hot things, how is that gum disease, or how could that be potentially?
Okay, there are different kinds that can cause a hot and cold sensitivity. It can be a root canal problem too, which is basically an emergency. But if it's caused just that little zing when you get out in the cold or you drink something and then it's gone, it could be recession, where your gums have gotten infected and swollen, and then they shrink back and leave some root exposed. And not only is that kind of unattractive.
So the root is sensitive.
Yeah, very much so, because it's not protected by your gums anymore, because your gums are diseased and shrunk back.
You know, I have, medical doctors on the show, and, plastic surgeons and dermatologists and different, orthopedic guys, but cosmetic dentists, and they think, or I shouldn't say they think, that's condescending, but they believe that they're changing people's lives. Do you feel that way with what you're doing with gum disease?
I know
do you
I'm
see
changing.
These, changes?
Absolutely. One of my favorite stories is I have a friend, he's a young guy my age. He came in and he had really loose teeth, and he said that his breath smelled really bad, and he just couldn't explain the bad taste that wouldn't go away. And he was an educated guy. I mean, this isn't just some guy off the street. He's a really smart man. So he came in and he asked me to take a look, and what I found was that his gum disease was completely out of control. So we went through a lot of different steps. And
what does that mean, out of control? Tell me what that means.
What that means is that
you took a look and what?
I don't want to gross anybody out, Randy, but he had a lot of bleeding and a lot of pus, and he can even have pus coming out of your gums, which is
and he didn't even see it. I mean, this is not something
he had no idea. He just could tell that things were not right, and he was uneasy with that. So we had him in, we worked him through a couple visits, and we got everything cleaned up, and now he's doing absolutely terrific. He's got through some rough patches in his life, and he's feeling like a new man in that he doesn't have pain. He can chew foods he couldn't eat
But they're
before.
smiling again, right?
He's happy. Yeah, he's doing so much better nowadays. And I'm really proud of him. He's one of the great guys in my life.
But you see that a lot, though? I mean, where
you
fix people's gum problems, their teeth get back in order?
Every day, Randy. Every single day.
Do you get thank yous?
I get thank yous.
Because I was thinking, does the periodontist get neglected just like people neglect their gums? I mean, or do they thank you just like everybody else? I mean, is it a big deal to them when the
periodontists get thank yous too? Yeah, that's going to be my new motto at my office: is periodontists get a thank you too.
All right,
absolutely.
All right. What's the number one misconception, by the way, about what you do as a periodontist, or about gum disease, I should say?
The number one about gum disease is that I'm not going to get it. Because odds are you're going to get it. I mean, like I said, there's 150 million people with gingivitis. There's 100 million people walking around with full-blown periodontitis. So odds are you're going to have a chance to get it at some time in your life. So that's number one. Number two is I can't do anything about it. I'm getting this recession. I've got the black triangles between my teeth. Everything looks ugly. I have no hope. I have nowhere to go. Well, that's not true. There's a lot of things we can do to get your mouth in shape and get you to where you can smile, you can eat, you can go out with your friends, and you can feel like you're showing them your very, very best.
Okay. When I hear pockets,
yes,
the general dentist, knowing you're going to come on the show talking about this, I'm asking a circle of friends. And
sure.
So if you've been told you have pockets in your mouth, what does that mean? And how serious is that? Is that the lingo of the pockets?
That's what I want to hear, yeah.
Okay.
And I'm really glad you told me that, because the general dentist is my eyes and ears.
Okay.
They're looking for it, because there's a lot of general dentists. They can see a lot more people than I can. They're getting everybody to me where we can fix them up. Okay. So what a pocket is where the germs have taken root, or they're grabbing onto your teeth, and they're making their little apartment complexes, and they're very, very happy there. And they're starting to dissolve away the bone. And as that happens, the gums start to shrink back too. And so there's more bacteria, and they're a worse kind of bacteria, and they start to do more and more damage.
You just remove the infection is what you're doing?
I get all the infection
So you get rid
out.
of the infection?
Yes.
And then their symptoms go away?
Their symptoms go away.
Okay. I was talking to this general dentist, by the way, about pockets and about you coming on the show. And he says, Randy, we tell people every day, I guess they call out these numbers, and they tell them you have, 4-millimeter pockets or whatever. And the people just said, okay, I'll think about it or whatever.
We'll watch it.
We can't get people to take us seriously about these pockets and about gum disease. Is that true, you think?
Yes, absolutely. And that's a big struggle for me, because a lot of times I won't see a patient until it's gotten so far where it's a lot bigger struggle for them to get things right. So if they listen to their dentist, and when they hear that 4 or 5, and even if they don't come see me, if they ask him, get your gums fixed. Don't let them go downhill anymore.
So it doesn't have to be a painful procedure.
No, it absolutely doesn't.
And it could be routine, an afternoon.
Yeah. And in early phases, a general dentist will do great, can take care of every problem that you have with your gums.
Okay. Okay. Now, and also with big high-end cosmetic cases, you guys are the go-to people, you say, to make those gums look good.
We're an absolute crucial part of the team.
Okay.
If you're going to spend thousands of dollars on your beautiful smile, and it's like building your house in the swamp. You don't want your house to sink into the swamp, just like you don't want your beautiful dental work to get all rotten and then fall to pieces and come out of your head just because you didn't go get your gums cleaned up. So I think, yeah, a periodontist is a very essential part of any cosmetic procedure.
What about the people that have really let it go out of control? They haven't been to the dentist in 15 years.
Some of my very favorite patients. And the reason why is because those are the ones I feel like I'm really going to be able to change their lives. Those are the ones that are going to tell me, Dr. Johnson, you got my teeth straight. Or Dr. Johnson, you saved my teeth so I'm not having to wear dentures all the time. Or Dr. Johnson, you saved me from having to go through all these months and months of painful procedures.
Did they ever say this was easy? Like
No.
this was easy?
Oh, yeah.
I mean, did they ever say, I should have done this years ago?
If they let it go really far, yes, that's what I hear is, man, I wish I would have done this a long, long time ago.
What are these pictures about? I mean, we're out of time, by the way.
These pictures are
I'm going
great.
to interview your partners, by the way.
Okay.
And we're going to get into, by the way, if you're just tuning in, about this connection between heart disease, diabetes, other inflammatory problems with teeth, and how to turn that around. Okay, so what is this? What are we looking at?
Okay, these pictures show kind of the 4 phases of periodontal disease.
Okay.
All right. Okay. So first picture shows what is healthy. So you see no bleeding, no shrinking gums, no black spaces, nothing. And as we move down to gingivitis, which is the first phase, you just see little red spots where it might bleed a little easier.
So like puffy gums, red gums, that's also?
Puffy. That's a great way to describe it, Randy. Excellent.
We talked, by the way, on the phone about this puffy gum thing, you and I.
Yeah.
And I had a waitress that day, puffy gums, and I was kind of nudging, who I was with, saying, I think that's gum disease.
I went in for my cleaning yesterday, and I had some puffy gums, so it can happen to anybody.
All right.
I'm a little embarrassed, but it can happen to me too.
Okay.
And then the next phase is when the gum starts to go, the bone starts to go away. And that's what you see on this one, where you don't see any pink triangles in between those teeth anymore. Pink triangles are gone. That means the bone's gone.
Interesting.
That's when the trouble
So this
starts.
is an infection. I mean, if we were to peel back those gums, these things are in bad shape.
It would look like on my model with a bone shrunken back and all the roots hanging out. And then the last one is the scary one where we have a lot of root hanging and a lot of black spaces. But the great thing is there's still things we can do. We can give them a beautiful smile. And the other thing we notice on this one is how the teeth are starting to spread apart and shift. And this is kind of the end stage if we don't get into
What's the black at the bottom of those teeth?
The black, those are fillings that are down.
Okay.
And they get, the roots are softer, so they get more cavities right.
Is that unusual, by the way, to see that? Because that's pretty bad.
Very, very common. You won't see it because, again, people won't smile who have these kind of teeth.
Okay.
Usually they're trying to hide them from everybody. But I see it every single day.
So even on that end stage, can that be reversible? Is it too late at that point?
Not always, Randy. Sometimes the disease can just get so far along that we cannot anymore save these teeth. They're gone. And that's okay in some ways because we're still going to get rid of the pain. We're still going to get rid of all the bleeding. We're still going to get rid of this infection that's attacking your body every day. And we're going to get you something beautiful. Okay?
So their gums clean up when you get rid of these teeth that have to go?
Yes, they look so much better. And then we have so many options for getting back teeth that may be so far gone that I can't save them anymore. And that's the beauty of our profession.
Okay, so final message, somebody, and we're going to interview your partners in just a moment. Final message, somebody, by the way, bleeding gums, puffy gums, all the symptoms you talk about.
Right.
Just what? Just give you guys a call.
Just give us a call. Give us a call, give your dentist a call, give somebody a call. Don't sit on it and just let it go downhill.
All right, well, thank you very much.
Thank you, Randy. I really appreciate it.
Very interesting stuff. Good job. Up next, more about gum disease. The good news, by the way, how to have the smile you've always wanted. We'll be right back.